Surrounding your anus and lower rectum is a network of veins that can expand and contract. When these veins become inflamed or swollen, the condition is known as hemorrhoids. Hemorrhoids can often be uncomfortable to have, but they are usually not considered to be a serious or malignant condition. There are actually both internal and external hemorrhoids. Internal hemorrhoids is when swollen or inflamed veins form in the lining of your anus and lower rectum. Internal and external hemorrhoids are separated by what is known as a dentate line, which is an anatomical landmark contrasting the different nerve innervations. Internal hemorrhoids can get swollen and enlarge, and on occasion bulge out of the anus, which is known as a prolapsed hemorrhoid. Internal hemorrhoids can be graded from grade 1 to grade 4 depending on if they prolapse and if manual reduction is required to put them back in place. Hemorrhoids are extremely common and most people are unaware that they even have them. About 1 in 20 Americans suffer from the condition, and it typically affects both men and women equally. Men tend to spend more time sitting for prolonged periods as well as lift heavy objects, which can cause straining, which are 2 suspected risk factors for hemorrhoids. That being said, women tend to deal with constipation more frequently and will often be diagnosed with hemorrhoids during pregnancy. Hemorrhoids typically become more common as you age. About half of all adults over 50 have hemorrhoids. As you age, the tissues that support the veins in your rectum and anus often stretch and weaken, increasing your risk of developing hemorrhoids later in life. However, hemorrhoids can also develop earlier in life due to certain lifestyle factors that increase your risk. Constipation often causes a person to excessively strain during an attempted bowel movement, which can exacerbate hemorrhoids. Intaking both an adequate amount of water and fiber is important to prevent constipation. Generally, 8-ounce glasses of water with a 20 to 34 gram fiber per day diet is recommended. Physical activity and exercise are also recommended to prevent constipation. It is also important to note that hemorrhoids can also result from an anal injury, such as during anal sex. The risk of hemorrhoids can also increase as a result of specific medical causes. For instance, if you are obese, the extra weight can place increased strain on your pelvic floor muscles, increasing the risk of developing hemorrhoids. Hemorrhoids are also a common occurrence during pregnancy. Typically during the 3rd trimester, this is mainly caused by the baby's weight putting pressure on the anal region and straining the veins around your anus and rectum. Also, the hormonal changes that your body will go through during pregnancy may cause your blood vessels to swell excessively. Another cause of hemorrhoid development may come at the end of pregnancy, especially during labor. The excessive straining needed during contractions may cause hemorrhoids to develop after you have delivered the baby. It is hard to say what exactly causes hemorrhoids. In simple terms, it's too much irritation or pressure being exerted on the veins around the anus. That pressure might be caused by several factors, including excessive straining during bowel movements, sitting on the toilet for too long, and chronic constipation or diarrhea. Other potential causes for hemorrhoids might be a low-fiber diet and frequently lifting heavy objects. Hemorrhoids can also occur due to the weakening of the supporting tissue in your anus and rectum. This commonly happens as you get older and for women during pregnancy. Hemorrhoids can be chronic and often painful, but only in rare circumstances do any complications result from having them. You may, for example, get a chance of bleeding hemorrhoids caused by a blood clot rupturing inside your hemorrhoids. In patients with persistent bleeding, anemia may develop. You may also find that you have skin tags, which are flaps of excess tissue that hang from the skin after a bout of hemorrhoids. A rare but most painful condition or complication that can result from hemorrhoids is strangulated hemorrhoids. This is where the muscles inside the anus contract and cut off the blood supply to a prolapsed internal hemorrhoid. Another complication may be a blood clot forming inside a hemorrhoid, or what we call a thrombosed hemorrhoid. While this is not a dangerous development, it is often extremely painful, and your doctor may decide to incise and drain it if the pain becomes excessive. There are several signs of hemorrhoids that may lead you to suspect you have the condition. If you are experiencing unexplained anal pain, it may signify that the veins are swollen and being squeezed by your anal muscles. Similarly, if the vein tissues have become inflamed, you may feel an uncomfortable burning sensation. Another sign of hemorrhoids is feeling irritation around your anus. Many people also feel like they still want to poop even after a bowel movement. This discomfort is usually caused by hemorrhoids bulging. You should consult your doctor if you have any cases of persistent or severe rectal bleeding or if there's significant pain. If symptoms are mild, then trying at-home treatment remedies may be used up to a week, which can be reasonable. You can do most of your hemorrhoid treatment at home without needing to see your doctor or your healthcare provider. The main aim of any treatment is to reduce the strain around the anus and lower rectum. The easiest way to do this is not to spend too much time sitting on a toilet and not to strain too much during a bowel movement. You can help this by changing your diet to include higher fiber foods. The US Department of Health and Human Services recommends that on average, adults should be eating between 22 to 34 grams of fiber per day. If you are eating less than this amount, you may be increasing the risk of constipation and diarrhea. You should also drink more water, as this will help prevent dehydration, which can lead to constipation. These simple steps should make it easier for you to make a bowel movement, as they will help us to soften your stool. You can also use a fiber supplement or stool softener if necessary to achieve the same effect. You can also help relieve any discomfort you may be experiencing by taking warm baths or sitz baths several times a day. A sitz bath is a small tub that can fit over your toilet, allowing you to sit for about 50 minutes in approximately 3 inches of warm water without actually taking a full bath. The treatment helps reduce swelling and may help relax the tightened sphincter muscle. Most symptoms of hemorrhoids will pass after a week. In the case of prolapsed hemorrhoids, they will usually go back inside on their own. And if they don't, they can often be gently pushed back in place. So how do you know if you have hemorrhoids? Your doctor will usually make a diagnosis based on your medical history and a physical exam. They will ask you about your eating and toilet habits and any current medical conditions you may have. For most cases of external hemorrhoids, they will be able to make a diagnosis simply by checking the area around the anus. If they suspect that you may have internal hemorrhoids, they will perform a digital rectal exam. This involves the doctor inserting a lubricated gloved finger into the rectum to feel for any abnormalities. As internal hemorrhoids can often be too soft to feel, they may also perform an anoscopy, which is an internal exam that uses a small tube called an anoscope to check the wall and lining of the anus and rectum. Most invasive exams are simple procedures done either in your doctor's office or an outpatient center. Your doctor may also choose to schedule you for a colonoscopy. They will typically do this if they suspect that you may have symptoms of another condition or that you may be at risk for colorectal cancer. When patients have rectal bleeding, it is difficult to rule out anything more proximal that is the cause of the bleeding, such as polyps or inflammation. Your doctor may prescribe you laxatives or suppositories to soften your stool and eliminate unnecessary straining during a bowel movement. Any itching or swelling can be treated with over-the-counter hemorrhoidal creams, ointments, or pads. These products typically contain ingredients such as hydrocortisone or lidocaine that can help ease the pain and itching. However, they also thin the skin, so it is not recommended to use them for more than a week. There are several natural remedies for hemorrhoids. Some patients suffering from hemorrhoids use witch hazel extract, which is a natural substance that can help tissues shrink. It also has properties that work as an anti-inflammatory to relieve any itching or burning sensations caused by their condition. Pure aloe vera is also known to be effective as an anti-inflammatory. Using coconut oil can also help with the urge to scratch. It is known to have moisturizing properties and can also reduce swelling. On occasion, even using a cold compress for about 15 minutes every hour can reduce the swelling and help numb the irritation. If the at-home treatments don't help and you're still suffering symptoms for after a week, you may need a medical procedure. Typically, the treatment will involve different techniques to cause scar tissue to form in the hemorrhoids. This cuts off the blood supply and usually shrinks the hemorrhoid. The most common medical procedure that your doctor may use is called a rubber band ligation. Here, a small band is placed around the base of a hemorrhoid, cutting off its blood supply from the vein. Patients often find rubber band ligation to be painful, and it often results in bleeding. However, the hemorrhoid will usually shrivel and fall off within a week. Rubber band ligation is successful for about 80% of patients, and only 10% need surgery as a follow-up treatment. Another procedure is sclerotherapy. Here, the doctor injects a chemical solution into the hemorrhoid to shrink it. It is a much less painful procedure than rubber band ligation. Still, it may not be as effective as treating the hemorrhoid in the longer term, with 30% of patients suffering a reoccurrence within 4 years. Other less common procedures include electrocoagulation, where an electrical current is used to stop the blood flow to an internal hemorrhoid. Your doctor may also try infrared coagulation, where they insert a small probe into the rectum that transmits heat to get rid of the hemorrhoid. Both coagulation treatments do not usually cause discomfort, and they aim to make the internal hemorrhoid harden and shrink. In severe cases, you may need surgery. Around 5 to 10% of patients will need a hemorrhoidectomy after at-home treatments have failed. A hemorrhoidectomy surgically removes large external hemorrhoids or prolapsed internal ones. Alternatively, your doctor may recommend hemorrhoid stapling. This procedure is used for internal hemorrhoids and involves using a stapling instrument to either remove the internal hemorrhoid or pull a prolapsed one back into anus and hold it there. The best way to prevent hemorrhoids is to take steps to avoid hard stools and constipation. This involves making sure you drink enough water throughout your day. It also requires increasing the amount of high fiber foods like whole grains and fresh fruits and vegetables. Likewise, staying physically active will also help keep your blood and bowels moving. When the time comes for bowel movement, don't delay it. And don't sit too long or push too hard when you are on the toilet. Also, taking stool softeners or laxatives can help treat constipation and hard stools. However, it may make it difficult for your body to regulate how and when you may need to make a bowel movement if you take them too often. Always consult your doctor before taking laxatives as a treatment for hemorrhoids.